Hi, my name is Jennifer Kranjak. I am an online hypnosis practitioner and I help people in the medical, surgical, and healthcare professions live healthier, happier lives. Now, sometimes in a profession like the healthcare world, you are going to encounter patient death. And you might be working with the patient directly in a surgical capacity, a medical capacity, maybe palliative care. You're watching the decline of somebody. What ends up happening is you start seeing these type of scenarios over and over and over again. You know this. You're going to know that you're going to have patients that are going to pass away. You were trained for this when you went to school. You were given as much preparation as you possibly could, but the reality is you are still a human being and you still respond emotionally to losing somebody that is in your care. And that alone adds a tremendous amount of stress and strain to a person. Now, sometimes you're going to be in an emergency situation where, somebody comes in and, you have to make these split second decisions to figure out what you can possibly do to save this person. And sometimes there's nothing that you can actually do. And you end up with some self doubt sometimes because of the fact that you did the best that you could, but what else could you have done? Because you've witnessed this so many times. And then maybe you're even dealing with the family and seeing their reaction to their loved one passing away, maybe even being blamed because you didn't save them. And that even adds more trauma to you. Sometimes you're with somebody for a long period of time and they're slowly dying. Maybe they have a condition that's it's going to be an inevitable end to their dilemma with their health care. They're going to end up passing away from it, and you want to help them, and maybe you have grown to really like this person or enjoy their company, or maybe they even remind you of someone that you love who has gone through something similar to this, and maybe you even lost that loved one and you're experiencing the similarities between this patient and that person you cared about. And it can, again, trauma stack. And when you start seeing this happening over and over again, even for some people on a daily basis, you're watching people pass away. You're doing a job where you are seeing death far more frequently than the general public ever will. And it will have an effect. And sometimes the only way to recover is to become numb. And that can actually happen where you just start blocking it out of your mind because you don't want to deal with that kind of emotion when you have to go into another room and smile and be happy when you're meeting another patient for a broken arm or something like that that you can deal with right away. You're trying to put on that happy face and you've got to block out what has just happened 10 minutes prior, and you have to just keep moving on. And when you keep blocking and blocking and blocking just to get through your day, the trauma starts to stack. It builds and it builds, and you start losing a bit of that sense of humanity. And sometimes you get insomnia, you're not sleeping, you have self doubt. Sometimes, if you're experiencing a stretch of time where you happen to have maybe more patient deaths than what is regular for you to see, maybe you start doubting yourself or wondering what's going on, or have that imposter syndrome, talking in your ear, telling you that you're not good enough, you're not a brilliant enough doctor, you're trying to be so perfect, and you're wondering if your colleagues are looking at you in a certain way or thinking certain things. And this will affect your mental health. It will actually add to depression, it'll add to anxiety, panic attacks, and it'll also start adding to isolation. And if you've maybe noticed that in yourself, because you just are losing the connection with that human part of you. And it's easier just to be alone with your thoughts. And the problem is, when you are alone with your thoughts and you are experiencing depression, that voice in your head starts to lie to you. It starts telling you all of the things that aren't true about yourself, or how capable you are in what you do, and that you're somehow not worthy enough to do the job that you're in. You went into this job because it was something that was important to you, it was a passion for you. You went into this with a good, open heart of care, and now you're feeling run down, exhausted, completely losing out on your social life in some cases. Relationships are deteriorating, and then you end up going in and you're dealing with grief. And it can make you angry, it can make you tired, it can make you break down. Maybe you're sneaking into the bathroom and crying alone for 5 minutes just to get away from it, just to relieve the strain. And this is no way to live. You know this. And being somebody who is in a healthcare profession, a lot of the time you want to take those pressures onto yourself and say, I can deal with this. I'm trained for this. And sometimes you don't really see it sneaking up on you. It just gradually happens to the point where one day you just think, holy smokes, I can't believe this is where I am. How did I get here? I actually heard one doctor, he was talking online saying he went out for pizza with his sister, and he said he took a bite and he thought he was born again because he couldn't believe that there was joy in the world. Like, and that would just changed his life. It was revolutionary. This wonderful pizza, something so small could remind you that there is something else outside of the doors of a hospital or an office. And that is the important thing to remember, is that you can only do so much. You're only human. You try to put on the face of perfection. So if you start feeling this way, you need to be able to look for somebody to help you. And it can be of any variety of healthcare options that are mental health care options that are available to you. And it can be difficult to ask for help, especially if you're in a situation where people are seeing you as that authority, that leader in healthcare. You don't want to look like the one that's weak. And a lot of the time that's how people view it in the healthcare community, and they don't want anybody to know. I've even heard stories of doctors driving miles out of town and using a false name so that they could have therapy because they didn't want anybody to know. And the type of practice that I offer for the community is an online practice. I am strictly a confidential practice that is not using your information on any official records. So my records are my records, but they don't go on your record. And everything is completely private. So you would be able to do your session in the privacy of your own home. It's completely confidential. And it's a way to help resolving the issues and finding better coping mechanisms with therapeutic hypnosis. That's what I do. It's a conversational hypnosis that will actually start changing the neurology around your emotions and helping you recover from that stacked trauma that you've been going through, and the grief and the anger and the pain that you've been experiencing, and allowing the mind to heal itself and gradually heal itself, or even rapidly heal itself in as little as one session. Because I know that you want results quickly, because you want that pain to stop. And that's what this type of hypnosis actually does, the kind that I do. And from that, you'll be able to cope every single day. You'll be able to recover your sleep pattern. You'll be able to feel more refreshed, feel more motivated. You'll be able to understand how you can find your own way to deal with a negative situation with a patient on the job. If they pass away or something happens and you can't save them because you can only do so much, there's ways that you will be able to find that you can take that moment to mourn briefly before you have to move into another room and deal with another patient or another situation, so that you can cope in a healthy way where it's not going to be damaging to you and your mental health over time. So this is the type of service that I offer. If you would like to learn more about what I do, I offer free consultations online over Zoom, and I'm happy to meet with you and discuss your situation further. And if you take a look, I have a Calendly link in the description with the video, and you can just go there and just book a free session with me to talk about your issue. You can go to my website, and there's a lot more information on the type of hypnosis that I do and the type of work I do with the healthcare community. Lots of videos there, and of course social media and YouTube has a lot more videos, a lot more resources for you to look at and to understand what I do even more. So I hope I've answered some questions. I hope this was informative and maybe even interesting for you to maybe explore a new form of therapy where it's private and your license is safe. And that's all it is for today. And I hope to see you in another video.